I am here to let Canadians know that we have granted BC's request for an amendment to their proposal. We have said yes, and it is effective immediately.
What does that mean?
That means that the proposal that was put forward to us by the government of BC to amend the public use consumption under the Section 56, the amendment has been granted.
What lessons would you take from that what lessons will you take from that for other potential applications or the go forward on this policy?
So let's be clear, the BC pilot is the only pilot in Canada at this time. We've moved forward with BC on this with a clear lens on public health and public safety, because we know that we need to address the opioid crisis and the overdose deaths that we're seeing as a public health issue. This is a health crisis, not a criminal one. Let's be clear, decriminalization did not make cocaine, fentanyl, or methamphetamines legal. The decriminalization pilot was very clear that it was about personal possession of a threshold amount of 2.5 grams for personal use only. This polarization that's been happening and this politicization of the reality that people are dying in our streets from an illegal toxic drug supply, to conflate that with whether it's... These drugs are illegal. They have remained illegal. We have not done. Decriminalization is about ensuring that people don't have to face stigma and actually go to get help. And I really am frustrated that the opposition has made this a dehumanizing debate for those who actually need our help, and that they don't recognize we need a full suite of tools to actually save lives. So in putting the amendment into effect, we want to make sure that police have direction and clear tools of when they encounter someone who is using drugs in a public space, what direction do they have? They should be directing them to healthcare. They should be directing them to supports and services, and that it's in extreme cases where there is public safety concerns that arrests can be made. We want to make sure that people are getting help. That is the focus of this. So when we sit down and look at a proposal, because we are firm on our policy here, we are firm in how we are moving forward to save lives, and to do that we have to have a careful, well-thought approach. We understood the urgency of this, but we also don't base our decisions on knee-jerk reactions. We base them on that there is clear direction and clear safety and supports for both communities and those who need help through healthcare.